A woman will be able to eat for the first time in 3 years after surgeons in the UK corrected a weight loss operation that she had in Turkey. Pinky Jolly almost died twice from infection because her treatment abroad and the cost to the NHS of saving her life has been over £100,000. A warning that this report from health correspondent Michelle Paduano contains images of surgery.
Doctors at Solihull Hospital planning to make a small pouch and bypass most of Pinky Jolly's stomach in the hope that she can get some life back.
It will change the world, even just not having the feeding tube. I'm going to be able to eat again, and it means you can go out with friends and socialise. It's just really limiting having this stuck in your face and hooked up to machines all day.
Pinky has been fed through a tube for the past 3 years after leaks from surgery led to sepsis, and she almost died twice. Her family know that the procedure carries risks.
This surgery is absolutely next level. On complexity 1 to 10, I would say it's 11. This is as complex as it comes. I mean, previous surgeons have tried to put this right, and they haven't been able to put it right.
An added complication, 3 years without solid food, has left her anemic.
What's the worst that can happen?
Death.
Okay.
2 consultants and a senior registrar are involved. They have to avoid a concretised ball inside her that, if opened, would cause sepsis.
So this is the mass. I think it's worse than I expected. The colon is here, stomach is here, liver is here, and there's spleen behind here. So everything is stuck together. I'm trying to create some space that I can go up.
Pinky's weight also had to be boosted 10 kilograms with high-calorie liquid foods ahead of the surgery.
After nearly 2 hours operating, the bypass has been achieved. But now Pinky will start losing weight extremely quickly, which she can ill afford. So they're putting in a feeding tube to try to stabilise her weight.
She won't eat for a few weeks, but the feeding tube in her nose has gone and she can now drink.
Well, not having the tube in, it's like having a free face again, because I can always see it, and it's not comfortable at all. And just the fact that you could do a normal human thing by picking a glass up and having a drink, it's lovely.
Doctors are worried that more and more patients like Pinky are suffering complications in Turkey, and these cases are stopping them treating NHS patients here.
Michelle Paduano, BBC News.
Well, let's speak now to Omar Khan, who's a consultant bariatric surgeon and chair of the National Bariatric Surgical Registry. Thank you for being on the programme this morning. We heard one example there, and I wonder, in your experience, how common is this sort of thing?
Sadly, we're seeing quite a few of these cases. I mean, in my own practice, we probably see one every 2 to 3 weeks of patients coming from abroad and having complications. So I'm afraid this is sadly a common problem now within the NHS.
And the problem, I guess, is one of the drivers that are pushing people to maybe seek this surgery overseas. I'm just looking here that the cost to have it done privately in the UK is between £10,000 and £15,000. If you have it done in Turkey, it's about £2,000. So you can understand why people are maybe going there for this surgery.
Absolutely, we can completely understand why. There is a problem with the NHS provision of bariatric surgery. We know that we don't do enough operations, and obviously there's a cost implications. But I think the issue is not so much going abroad, but going abroad where the main driver is price. Because if you compare, say, an operation costing £2,000 versus £10,000, you've got to ask the question, what are they missing out? What safety protocols are they not following? And what safety netting do they not provide? It's a bit like buying a car without insurance. It may be cheaper, but it's not safer.
So, yes, that was going to be my question. Is it that the UK is particularly expensive, or is it that places like Turkey are particularly cheap?
I think if you look at some of the Turkish institutions, their costs are comparable to the UK. So when we talk about this £2,000 figure, it tends to be institutions which I do think are avoiding some of the standard safety protocols.
One of the challenges, I suppose, and we've talked about this in other fields, things like dentistry, people going to maybe Turkey to have their teeth fixed and then actually causing further problems down the line. There's one thing perhaps with dentistry where it may be uncomfortable or it may be damaging to the rest of the teeth. This is life-threatening, so this has to be fixed by the NHS, doesn't it? But as we were reporting, at significant cost to the NHS.
Absolutely. I mean, if a patient comes in and they're critically unwell, they'll be managed by the NHS. The problem with specifically weight loss surgery is the complications tend to happen to 1 to 2 weeks after surgery. And in the UK, we've got a very robust system where we have safety netting. Patients are given surgeon's contact details. And if there's a complication, which does happen in all types of surgery, that is managed well and appropriately. I'm afraid that's not necessarily true of some of the operations done abroad.
So what impact is having to fix this sort of surgery having on the health service?
Unfortunately, it's obviously, first of all, cost to the patient. You've just heard a very sad story there about someone who's had a feeding tube in for a year, but it's also a financial cost. We've done a study which has shown that if you look at the London hospitals, the money we spent on dealing with complications from surgery abroad would have paid for 160 operations to be done in the NHS. So clearly there's limited resources and we want to allocate that appropriately to primary cases in the UK we can do ourselves.
Yes, significant extra cost just fixing the problem. And I suppose, as we touched on, people will still go to places overseas for this sort of surgery. So what advice would you give them? What should they be looking for to make sure they're not putting themselves at risk?
I think the key thing is to apply the same rules that you would in the UK. So in other words, what is the surgeon's expertise? What is the hospital's expertise? Are the results of the hospital available? In the UK, all of the surgeons and hospitals' data are publicly available on the website. And I think the most important question is, what safeguards does the hospital have when there's a problem? It's not acceptable for a hospital to say, if there's a problem, go back to your local A&E. That's unacceptable care. In the UK, there's obviously relationships between, say, private hospitals and the NHS, or NHS and other NHS hospitals. And if your hospital abroad can't have the same safeguards, then it's not appropriate to go.
Good to talk to you this morning. Thank you. That's Omar Khan there, consultant bariatric surgeon and chair of the National Bariatric Surgical Registry. Thank you.